Hello, my name is Faith, and this is Sydney and Hayley. Today we are talking about postpartum mental health. We chose this topic because we felt like it was an emerging practice in OT, and just really there's not enough research about it. And even as we were researching our individual topics, it was really hard to find this current research about any of it. So these are our objectives for our presentation. So we plan to discuss the components of physical health that impact postpartum mental health, discuss the social factors that affect postpartum mental health, discuss considerations of occupational therapy and potential treatments that could benefit the mental health of postpartum mothers, and discuss the importance of addressing postpartum mental health. So talking specifically about the mother's physical health, throughout pregnancy, a woman's body is constantly changing to adapt to growing a new baby. Overall, postpartum women report feeling unsatisfied with their body weight, the amount of strength that they have, and their overall fitness. There are also a variety of physical issues that postpartum women encounter. These issues can include things such as musculoskeletal pain, and physical changes that are occurring, such as pelvic floor changes. Another factor to consider is the amount of education the mother has received, either prior to her pregnancy or shortly after giving birth, what to expect. One example that I found in the research about musculoskeletal pain was related to posture issues, and this wasn't something I was expecting to read about, but they were talking specifically about women that are breastfeeding and how their posture becomes an issue because that's not what they're focusing on. And then that goes back to causing back pains. And most of these women found that that's not something they were educated on by any of their healthcare practitioners. That wasn't a big concern when being educated on breastfeeding. So each of the mothers that go through this have many physical changes due to the pregnancy in general and giving birth, as well as emotional changes that are also occurring due to hormones. Each of these things can then come back and cause issues with the mother's mental health. Specifically talking about the physical changes that can occur, research suggests that throughout pregnancy, women notice a decline in their endurance and perineal muscle strength. One important factor influencing the number of changes that occur in the pelvic floor is the amount of pelvic trauma endured, which indicates that vaginal deliveries are correlated with more dysfunction. The most common side effects from pregnancy and giving birth include urinary and bowel incontinence, back pain, pelvic organ prolapse, perineal pain, and sexual dysfunction. Studies suggest that women specifically reporting urinary and bowel incontinence report major interferences with their daily lives due to not wanting to be embarrassed in public. Physical changes are often overlooked as being a factor that could influence the mental health of anyone, but specifically are not always considered for a mother. Women who are experiencing these physical changes will often not participate in social activities. The fear these women that have these symptoms experience often lead to pulling out of social, leisure, and work activities, and they even experience disruptions in their sleeping habits. A research study was conducted on stress and social supports and the relationship that they have with depression. There was specifically a relationship between depression and mothers who did not partake in social activities. These women were found to be lacking in social supports, and they experienced struggles with societal expectations.
Okay, so moving on to social factors, I'm going to dive into societal expectations a little bit more and how stigma can result from not meeting societal expectations. So many postpartum women may experience stigma due to weight gain, as well as any postpartum mental health challenge they could endure. Weight gain is essential to a healthy pregnancy, but weight stigma affects about 2/3 of pregnant and postpartum women in the U.S. As previously mentioned by Faith, postpartum women, tend to be dissatisfied with their body as it is, and the physiological changes of pregnancy typically result in weight gain. And according to a survey of women of various pre-pregnancy BMI values, so that's to say not just women who were considered overweight or obese before pregnancy, but women across the board reported experiencing weight stigmatization during their pregnancy or postpartum period, especially from the media. And to expand on that, higher levels of social media use in postpartum women was associated with greater body dissatisfaction and the development of eating disorder ideation, or just an eating disorder in general. Stigma can also come from, women who experience mental health disorders may also experience stigma. And despite it affecting 13% of mothers in the US, a lot go undiagnosed and untreated, and stigma is believed to be a contributing factor to that. Some of these women, when spoken to about it, they feared that the development of a postpartum mental health challenge could suggest that they're failing as a mother, and they decided to forego treatment as a result. Stigmatization of these commonplace effects from pregnancy threatens the mental health of postpartum mothers and the well-being of their whole family. Societal expectations also dictate parenting roles. According to American adults, women are disproportionately pressured to fulfill child rearing and homemaking responsibilities, while men are disproportionately pressured to be the main breadwinner. So despite being more involved in the workforce in previous history, women are spending more time on childcare, about 14 hours a week, compared to when they were providing childcare in 1965, where they spent about 10 hours a week doing childcare. And to refer to the men pressured to be breadwinners, 46% of US households rely on two incomes, and 4 out of 10 mothers are the primary breadwinner. So strong social supports such as partners and spouses, family, friends, community, and healthcare professionals may help to ensure that parenting responsibilities are more evenly distributed and combat the negative effects of unrealistic societal expectations. Now moving on to social support, just going to dive into that a little bit more. Spouse and partner support is really important. About 92% of women feel their spouse or partner is their main source of support. And sufficient spousal or partner support has been shown to benefit postpartum mothers transition into parenthood, share parental responsibilities, their feelings of self-efficacy, their mental health, social participation, and their ability to cope with stress. Now I say sufficient because women who had a partner that was a younger male with lower education tended to not feel as supported compared to women with older, more highly educated partners. So it needs to be a sufficient amount of support to be beneficial. However, single motherhood was associated with poor perceived social support and lower social participation compared to motherhood within a marriage. I also want to talk about family, friends, and community, which we found a lot of times is studied together as their social network. Mothers tend to feel more well integrated into their community compared to women who are not. However, the age of the infant may impact the level of support they feel. So in a study of women, they were split into two groups. It was women with infants below the age of 3 months and women with infants 3 months or older. The women with younger infants tend to feel a higher level of perceived support compared to women whose infants were older. And not surprisingly, the women with older infants reported higher rates of postpartum anxiety and depression compared to the women with younger infants. And then healthcare practitioners, I wanted to drive home, as a lot of us are entering the healthcare field very soon. Many postpartum women report feeling their medical providers are only concerned about the health of their child, and a lot of their physical and mental needs are left unmet as a result. So more research needs to be conducted to evaluate how healthcare practitioners can better support postpartum mothers, but building therapeutic rapport has been proven to be important. I'm going to pass it to Hayley, who's going to expand on that a little bit more.
Okay. So with co-occupation, it represents the inseparable link between the mother and infant, which is developed by activities that promote bonding, development, and maternal well-being. Some common co-occupations are breastfeeding or bottle feeding, comforting, caretaking, and play. These changes in occupation that postpartum women experience can reduce their capacity to maintain usual routines or roles, which can increase stress. This increase in stress can inhibit a healthy role adaptation. The recent literature is beginning to discover the potential for occupational therapists to reduce maternal role strain, ultimately helping to prevent postpartum mental health issues. So why are occupational therapists a good fit? The nature of postpartum care calls for interprofessional collaboration. However, OT is commonly underutilized. OTs are the expert in addressing occupational performance challenges and providing holistic, client-centered care. OTs are trained to observe and evaluate improper body mechanics, signs of mental health issues, as well as evaluate the environment in order to make modifications. The lack of referrals for postpartum women to occupational therapy is why education and advocacy for our profession is so important. So quickly looking at intervention, the primary goal of intervention for OTs for postpartum women is to decrease pain, increase functional ability, and promote engagement in meaningful occupation. OTs can help postpartum women who experience mental health issues establish routines that promote lifestyle balance during the transition into motherhood. Some examples include mindfulness, time management, education, community programming, and telehealth services. So these are, just to wrap it up.
So why is postpartum mental health important? Approximately 43.5 million women in the United States are mothers, and during the postpartum period following birth, women undergo physiological, psychological, emotional, social, and role changes. These changes increase the mother's risk of developing a mood and/or anxiety disorder threatening the mental health of the mother. Additionally, a new family member and changing roles can put a strain on the family unit as a whole. These are our references. Does anyone have any questions?